It's hard for all of us to imagine that 10 years have passed since the epic battle that my father and General Butterworth and so many of the advocates that are here and that were shoulder to shoulder with us in that battle fought back on August 25th, 2007. He and my mother brought in the youth and actually worked with them to have them help guide and devise the campaign. Many mistakes had been made in the past about running anti-tobacco messages just centering on health issues, which teens, we all know, feel like they're invincible. But once the teens came on board and were actually part of crafting the messages, we saw tremendous impacts in not just the messages and the impacts and the effects that they had, but also their involvement. Adrian, here's an example of that. There are many other examples of young people that have come into the system as a result of this campaign. And that's good. That's very good politics, and that's good for our democracies.
And what's interesting about this program, and it was led by Mrs. Childs and the children of this state, and it's interesting, and Bud mentioned it very well, where the children were, I shouldn't say children, young adults were there, designed their own ads. I looked at those ads and I said, that's not going to prevent anybody from smoking. But it did. The most effective ads in the country, because the people who were being advertised to be hooked on tobacco were now the ones saying, we've had it, we're not going to let you do this anymore. The ads were so effective. Smoking dropped amongst teens. But they were so effective that after our settlement, and when tobacco company went in almost a year later to settle with the other 46 states, they would not allow there to be an advertising type of program as there was in Florida because it was so effective.
We've come a long way since 1997 in the fight against smoking, especially in preventing smoking among kids. But we have unfinished business to protect the people of Florida. According to Florida's adult tobacco survey last year, more than 17% of Floridians still smoke cigarettes. That's more than 3.1 million Floridians. Most smokers do want to quit. 70% at least want to quit, according to the CDC. Almost half of current smokers have tried to quit smoking this past year, and nearly 60% say they plan to quit smoking in the next 6 months. So if so many people want to quit, why don't they? The answer is that smoking is considered by many of us to be the worst addiction you can possibly have. It's not just simply a personal choice. They're chemically addictive. It takes most smokers several attempts before they can kick the habit successfully. And like many other addictions, even after a year of not smoking, the risk of relapse will always be there. To reduce smoking in our society, we must make more resources available to help people quit. This must be the next step in the battle against big tobacco. Government, private employers, insurance companies must work together to ensure that CDC-recommended pharmacological treatment and counseling programs, they have to go together, are available for everybody who wants to quit, not just once, but for a couple of times that it might take until they're really successful.
Florida's tobacco settlement was the first and the greatest of a series of reforms that not only changed Florida, but also changed the world to protect our children from the pain and disability that smoking can cause. Governor Childs, General Butterworth, and the thousands of public health advocates deserve credit for achieving this monumental victory. But we can't become complacent, and there's still much work that needs to be done. Today, we also commend the Florida legislators and Governor Criss for recognizing that people who are addicted to smoking need assistance. Working with employers to provide incentives to aid workers to quit smoking. Making coverage of smoking cessation treatment a standard benefit in all health plans. And finally, incorporating smoking cessation treatments into comprehensive care for cancer patients, survivors, and their families.
You can imagine what it felt like as a kid from a very small town to not only meet, but talk to and have lunch with the great Governor Lawton Childs and hear him explain the settlement agreement and invite us to participate in a positive new youth movement called the Students Working Against Tobacco, or SWAT. The campaign believed in the power of young people to change the world and make it a better place. It inspired me to work to mobilize students, my peers, in my community to not only resist cigarettes but other tobacco products and even drugs. I became deeply involved in SWAT, eventually becoming the state chair in 2003, later moving on to serve as the National Youth Board Liaison to the American Legacy Foundation, who created the National Truth Anti-Smoking Campaign, and later serve in other various capacities on the national level. I firmly believe that the drop in youth smoking numbers is a direct result of these concerted efforts to mobilize young people against tobacco.